Vanakkam. Welcome to this course on biomedical instrumentation. We have been looking at ventilators. In this video, we will look at the various types of maneuvers that are performed. What is a maneuver? Maneuver is specialized intervention many times that require modification of ventilation mode, for example, or some specialized deliberate adjustments are made in the ventilation method. So, it is not something that you do, but rather specialized deliberate interventions and adjustments that are done. These are temporary modifications, deliberate temporary adjustments or modifications that are. People used to think whenever you say something like that, whenever you say maneuver, people think that this is manual. Nowadays, maneuvers are also automated, maybe automated in some cases, and it does not usually require removal of ventilation while keeping ventilation on, while ventilation is still on, this is performed. This is critical because from the advent and identification and recognition of ventilator induced lung injury, for example, barotrauma was recognized in, for example, in 1970s, and volute trauma was later, not volume trauma, rather volute trauma was recognized in the 1990s. From that point, there is a need to perform this kind of adjustments was felt from that point. So, these are the various adjustments or maneuvers that are possible. These are the suction maneuver, recruitment maneuver, sigh maneuver, inspiratory hold maneuver, expiratory hold maneuver, intrinsic PEEP maneuver, and this special maneuver from a company called Drager. This is not a standard, different companies have different names, they have branded the maneuvers. So, this is Drager's maneuver called oxygeny maneuver, but this essentially does not represent the generic method, but is specific to that machine, for example. So, before we move on to specific maneuvers, these are the procedures that are performed. Procedures are deliberate adjustments are performed during ventilation cycles. These are performed to improve the efficiency of ventilation and improve respiration. There are different types of maneuvers that are used for different conditions depending on the situation. Modern ventilators usually opt for maneuvers during ventilation. Nowadays, it is possible to do while ventilating, you can adjust, that is possible, and sometimes control schemes may be also adjusted using machine itself. So, it may be also be automated, it need not be just manual. Instead of performing manual, now there are some advanced algorithms that might do that, but some maneuvers might require additional accessories, additional resources, some additional sensors, some additional things might be needed. First is the suction maneuver that is used to remove the excess mucus that is blocking the airways. In some cases, this is also used to remove other substances that are blocking the airway. When this is implemented, ventilator stops for a particular amount of time, and then the suction device is used during that time and remove, and patients will be pre-oxygenated at 100% FiO2. There are some complications associated with this maneuver like hypoxia, bronchospasm, and some complications are there, but this is needed to remove mucus secretion. What are the various things, various parameters that you need to overcome to remove mucus? To remove mucus must overcome, what are the things that we must overcome? We must overcome suction forces, must overcome cohesive forces, also often overlooked is surface tension. There is a need to do nitrogen washout. This pre-oxygenated requires nitrogen washout. This nitrogen washout has a time constant of about 3 to 5 minutes. Takes time to do this, 3 to 5 minutes to perform nitrogen washout, that is there. There is a possibility that there will be hypoxemia is a possibility, right. 10 to 15 seconds you should perform this suction only for small periods of time, 10 to 15 seconds only, otherwise could result in hypoxemia. Otherwise, you can also avoid bronchospasm by properly inserting the catheter, for example. The other problem is atelectasis. Just one second. The other possibility, the other problem is atelectasis. What is this? Essentially refers to the collapsing of the lungs alveoli. Right. This is the other problem that could, other complication that could arise from this maneuver, something to keep in mind. That would, you can avoid atelectasis. How can you avoid atelectasis? By maintaining PEEP. If you maintain PEEP, you can avoid atelectasis, something to keep in mind. The second maneuver is called recruitment maneuver. This is used to reopen collapsed alveoli and improve oxygenation, especially in ARDS or post-operative atelectasis. What are the methods that are used? Usually sustained inflation of about 30 to 40 centimeter water and 30 to 40 seconds is usually used. There are 2-3 methods: sustained inflation, stepwise in inflation, or staircase inflation. There are different methods that are possible. And this is used when there is refractory hypoxemia. When there is refractory hypoxemia, this is used. Decreased lung compliance is there as a fallout of lung pathology. If there is decreased lung compliance or significant atelectasis is there. Despite optimal ventilator settings, you see significant atelectasis. What is atelectasis? Situation in which the alveoli are collapsed. You have to open the alveoli. Right. This requires a continuous observation of oxygen saturation level and blood pressure levels and heart rate and airway pressures during the maneuver. It can cause hypotension, it can cause barotrauma, it can cause arrhythmias and alveolar over. If you are doing too much of this, it is possible that alveoli will be over distended. That is also an extremely dangerous situation that can cause micro or nano damage to the alveoli. At cellular level, mechanical wear and tear might happen at the level of alveoli. That is the other possibility. Right. Note that this time constant is resistance times compliance, is it not? That is essentially about, this time constant is about half to 1 second in normal cases, and in consolidated cases about 2 to 5 seconds. But in atelectasis, severe atelectasis, this time constant can be as high as 10 seconds. That is a long time. Then it is about 10 to 20 times the original time constant. Right. In severe atelectasis, that is a possibility. There are different approaches that you can use that we already saw: sustained inflation, stepwise inflation, or staircase based inflation. Then you have the psi maneuver. This is a maneuver that delivers occasional larger than normal tidal volumes. This ensures atelectasis or alveolar collapse and make sure that the lung compliance is maintained. Usually this is set at a very high value of normal tidal volume, at about 1.5 to 2 times the regular tidal volume, normal tidal volume, but performed at regular intervals. This is used on patients who have been on prolonged mechanical ventilation to ensure that atelectasis is minimized. But of course, you should not do it too frequently, because if you do it too frequently, volutrauma might happen or some form of hemodynamic compromise might happen. Humans usually perform psi 9 to 12 times an hour. Normal psi, all humans normally they psi anywhere from 9 to 12 times an hour. Normal humans, right? Why do we do that? Why do normal humans also do that? because to prevent micro or nano atelectasis at the smallest level, to prevent even small amounts of atelectasis, we sigh. This is done by all humans, healthy humans also, right. The idea is to improve this by 1.5 to 2 times. What will this do is, it will improve surfactant distribution. Surfactants will be distributed more if you do sigh maneuver, right. How it will also increase surface area, is it not? Because as more and more alveoli become open from collapse, surface area will increase. That is the whole idea, right, and essentially ensures mechanical spreading. This is like akin to, like, have you heard of disk defragmentation? In the good old days, while using Windows, you perform disk defragmentation. A file might be present in multiple locations within the hard disk, physical locations within the hard disk in different fragments, but if you keep them together, it is easy to access that. This is called as, to keep them together, a process called disk defragmentation is quite often performed. So, this sigh maneuver is essentially a form of lung defragmentation or something comparable, something to keep in mind. Then you have the inspiratory hold maneuver. This is a maneuver in which airway flow is paused at end inspiration and essentially allows for equilibration of airway pressure and alveolar pressure. This is used to measure plateau pressure that is often reflective of the alveolar pressure. It helps to compute respiratory system compliance and the driving pressure. If you perform too long this inspiratory hold maneuver, this may increase barotrauma and patient discomfort if not carefully done. So, it is a complicated advanced procedure. The next is expiratory hold maneuver. This is a maneuver in which airflow is paused at the end of expiration. It is it helps us to measure intrinsic PEEP or auto PEEP in mechanically ventilated patients, and how much can the patient exhale by themselves, like, quite often it is used in conditions like chronic obstructive pulmonary disease or asthma to access dynamic hyperinflation of the lungs. It helps to adjust ventilator settings to reduce trapping of air and improve ventilation. Right. So, because of this incomplete emptying that is happening. Right. Prolonged holds again can cause discomfort and hemodynamic compromise if not carefully applied. So, it is a very complicated, it is a complex procedure. Right. Intrinsic PEEP maneuver is a maneuver that involves performing an expiratory hold at the end expiration on a ventilator. Again, helps us to measurement of auto PEEP. Quite often this is performed. Then you have the oxygeny maneuver. This case, this is a particular case of a maneuver that is performed by dragger, that we have discussed previously in the previous slides. With this, we come to the end of this video. In this video, we looked at the various maneuvers that are there: suction maneuver, recruit maneuver, sigh maneuver, inspiratory hold, inspiratory PEEP, expiratory hold, and oxygeny maneuver. Now, how do you decide which one to do? Essentially, if there are secretions, then do suction. Okay. If there is a refractive hypoxemia due to, is it due to ARDS or atelectasis, then perform recruitment. Prolonged ventilation, if the patient is on prolonged ventilation, perform sigh maneuver, and you want to you want to have an idea of mechanical assessment of lung function, healthy lung function. Well, in that case, inspiratory hold or auto PEEP are one of the PEEP maneuvers. With this, we come to the end of this video. Thank you very much for your attention.